one of the aspirations, I guess, for the network is around this idea that we try to create a community of practice that isn't top-down, but is about trying to engage with people that are working at the coalface in order that we might try to be able to create an environment within which you might experience some of those factors that go towards resilience, building resilience. So, having a voice, feeling valued, and also to be able to access some of the skills and resources that we can harness by being a network. And that includes communication, problem solving, and also linking with others. And I think that's what I want to give you a flavour of what we've been doing over the past several months. Particularly, then, I want to highlight a piece of work that we see going into 2016-17, which is around parative esteem and really promoting the role of psychology and the psychological professions and psychological approaches within physical healthcare. Because certainly, our bread and butter is understanding about mental health, mental distress, mental well-being. But certainly one of the things that has really, really been an eye-opener to me going into a much more wider environment of Health Education Northwest and reaching into NHS England and kind of hearing the sorts of issues that are coming up as priorities with commissioners, that the things that we just take for granted still aren't within common language and thinking. Across healthcare, the making the link between mental health, physical health, and the role that psychological approaches can have in enhancing both of those elements of care. There's still a lot of work to do. So Lucie is going to join me shortly when I give her the nod, and she's going to talk about a piece of work and introduce you to our second animation, which will be the start of our communication campaign, and hopefully a programme of work that will help us think creatively about how we might engage with this dialogue that we're being offered. You may or you may not remember this diagram. I always show it saying, I really don't expect you to kind of remember all of this or understand it all. But part of my job as the programme manager of the network has been to try to shape, kind of give some structure and map out where all the different influences and feeds are into what creates a network that's meaningful and productive. And this is my best attempt. And it's a work in progress. It changes every time I present it. But we are in the process of commissioning a piece of work so this can be animated. So what Geeta and I have what we're starting to understand is actually to be able to articulate how a network works. You can't do it in a linear kind of static way. You need arrows and links to be dynamic, because that's really what this is about. Just this event today, we have speakers and we're presenting you with information, but the majority of the network work actually is happening out here with you. You'll go away and there will be things that will come out of you having met that hopefully will spin off into things that you'll take back into practice that we might not know about. But that's part of us building this community of practice, that kind of dynamism. But this is a kind of linear description, really, of what's happening. And really, within this diagram, I've quite deliberately placed the Psychological Professions Network at the centre, because that's kind of the middle of our world. But you'll see that there are lots of arrows that are going in and out of different organisations. And one of the challenges, I think, is trying to work out what are all the organisations that now consist of the NHS. What are the different bits of the NHS doing, and how do we link into those meaningfully? So, over the past 6 months, sorry, I feel like this has disappeared. Over the past 6 months, one of the significant pieces of work that we've been doing with the Workforce Board, which is now consists of, I think there are 25 or 26 members of the Workforce Board, all representing different parts of the psychological professions. Some of those are chairs of special interest groups that existed already. Some are groups that we have helped to set up. And some are groups that are arm's length to us, but it's really important that we have representation around that area of the work that we do. So I don't know, members of the Workforce Board that are here, do you want to put up your hands and show who you are? Reveal yourselves. There are a number of people here. Some you'll recognise, so we've got representation from clinical psychology, from education, from psychological wellbeing practitioners. We've got psychotherapies and different types of choice. We've got health psychology. We've got military veterans. We've got the deaf community. So not everybody that's on the Workforce Board is here today, but hopefully what the people here will give you an understanding of is that we have a very, very broad Workforce Board, and we've been working together since February. I think we've had 3-4 meetings now. One of the key things that Workforce Board has been engaged in has been thinking about how do we relate to Health Education Northwest. So Health Education Northwest is the organisation that funds the network. Hence they're kind of at the top of our funnel. They're very important because their role is they commission education and training. They commission undergraduate training, pre-registration training, but they also commission and fund continuing professional development. So we're engaged in looking at how can we improve CPD opportunities and inform those things that are available. A new piece of work for us, and new for us to understand, is workforce planning, which in the past would have left me cold. I wouldn't have really been that interested or thought it was anything to do with us. And really we've been on a bit of a journey with the Workforce Board members to start to help those practitioners to understand what workforce planning is and how that planning links into how the NHS develops and grows. Traditionally, workforce planning has been done informed by services. So every year, your employers, somewhere in your employing organisation, a request for a profile, a kind of a forecast of what services what their work is going to be and the workforce that they're going to need to do that. So what are their crunch points, where are their gaps, but also where do they want to develop things. What's become clear over this year, as we've had sight of those returns from the services, is awareness and input around mental health, and then within that, psychological professions is very, very underdeveloped. And the workforce planners know that. So one of the things that's really, really important that we've been asked to do is that we've been asked to contribute to what they call the narrative of the workforce plan. So as a network, we've been asked to, through the Workforce Board, collate a response to the service returns that are coming in. This kind of sense check, they call it. They kind of say, does this make sense? Are there things that are missing in this? And then to add a narrative, so some detail around what does the workforce and the expertise of people on the ground that are members of the network, what do they think are the priorities? What would they like to see as part of the vision for developing mental health and psychological professions, and particularly around parity of esteem. Parity of esteem is a real lever for us at the moment. It's a great phrase, but the interesting thing is that people don't really know what it means. So one of our missions this year, through the physical health and psychological approaches animation and the piece of work that follows from that, we want to really try to start articulating what parity of esteem means and helping NHS England and our commissioning colleagues, our psychiatry colleagues, understand what that is so that we can start to really at least keep the profile of mental health as it's supposed to be involved. So Our links into NHS Health Education Northwest and Health Education in the north of England are growing, and the detail of it is something that we don't have time to go into today, but the Workforce Board is becoming a really important engine room for the collection of intelligence and data and kind of responses to questions that are being asked of us by the workforce planning team. So one of the things that I would ask of you is find out who the Workforce Board member is that relates to your area of practice. There's a place on the website where there's a description of the Workforce Board and a list of who the representatives are. If there are special interest groups that are ran, then get to those and kind of ask questions and start thinking about putting in your perspective so that the board members have got things to bring to the network. And also, if you think there's a gap on that Workforce Board that we need representation on, then get in touch with me, because we're growing. It's an organic process, and through the year we'll continue to develop that programme of work. So certainly at the beginning of next year, we'll be starting to say to the Workforce Board what we're going to put in the narrative when it's asked of us in June, July. So look out for those requests, get into those conversations, find out who your Workforce Board member is, and have a conversation with them. So I'm really pleased that we've been able to think about linking into Health Education Northwest, but also we're starting to find out who our kind of external partners are. And there are a number of pieces of work that are going on around those areas. One significant area is NHS England, and the strategic clinical networks in the Northwest are increasingly keen to link with the network. And I think that's in recognition that the split that's happened between providers and commissioners isn't helping solve problems and get things done. So particularly for 2016-17, one of the things I'm really pleased that we've been able to do is bring together NHS England and the strategic clinical networks to join us in our IAP Leadership and Innovation Forum. So we continue to support the IAP Forum, which has a long history from us having been a programme of work. And very artificially, commissioners have ended up being split out of that forum because of the changes that have happened in the reorganisation of the NHS. It's taken a couple of years, but the strategic clinical networks and NHS England are coming back to me and saying, how can we link in to your network? Because we know we need to sit down alongside providers to work out some of the problems that we're both faced with, and that the forum that the network offers is a really useful space that's a bit kind of neutral territory. So, people can sit outside of the day-to-day management, commissioning, performance management issues, and maybe we can create some space around problem solving and really getting involved in some of the community of practice activity that is envisaged, which is around solving problems, putting heads together to think about doing things differently. So those of you that are involved in IAP services, we've got our first joint event in December, and part of that event is to shape up how we work together in 2016-17 going forward, and they're going to jointly fund those forums. So I think that's an example of how having a network with a presence and some credibility because of all of your membership and the kind of presence that you bring is actually helping us reach out and start to have influence with those organisations that we have been trying to rebuild links with. Okay, so that's kind of sort of thinking about a snapshot of some of the external work that's going on and how we're building those links. And there's other work that's going on with other organisations that will lead to particular programmes of work further on down the line. But I guess one of the things that we're very keen to promote is this idea that we want to create this community of practice. And this is a diagram I keep coming back to, but we have a number of different of special interest groups that are developing. We continue to support them, and they're continuing to grow. So you have a list of those on the website. If you're not involved in them already, take a look under our groups. We're supporting some of those groups to become self-managing. We're getting output from some of those groups. So, for instance, we have a counselling in the NHS group that's starting to think about what are the issues around the counselling workforce. We have psychological wellbeing practitioners that are taking on the professional issues around PWPs. We've had a very active dialogue and discussion that's been going on around the registration of psychological wellbeing practitioners and governance issues. And so we're really hoping that these groups we can support those groups to take on some of the issues that are particularly important to yourselves on the ground. Quick snapshot. Geeta said we're doing well in terms of membership. So last count we had over 1,500 members, which is great. That compares very well to the other networks. That means that all those people are getting that weekly news bulletin that drops in your email box, and that links into the website. So that online presence, I think, is very important. It's a way of us disseminating, but also it's a tool for yourselves. So think of that network and the e-bulletin as a tool that you can use to disseminate and link in. We're always open to opportunity to ideas around how we might develop the website, and we'll be leading a review of it in the coming year. We have loads of great photographs of all of yourselves from the conferences. And I was just saying at lunchtime that what we want to do is review the website and the visuals, because it's all very shiny American, and we want to, we know now that we've got a bit of an identity. So there'll be a review of that. And the other thing that we've been doing is that we've been funding and supporting one-off Kickstart events and some masterclasses that have been directed at different parts of the workforce that have come forward with ideas. So I guess the message in that is, if you think there's anything within that resource of the network that might help you or support your part of the workforce, your group, come and have a conversation with me. Because it's not always about money. Sometimes it's about connecting people, and we're starting to have those connections. We've just had a new revised leaflet and postcard done for the network that links in with the animation. You've got copies of that in your bags, your conference packs, and it'll be available on the website. If any of you want hard copies of it, we've got printed copies, and we can send out kind of packs of them. But we encourage you to disseminate and distribute those at groups, any of the groups that you might be going to. Anybody that you think it might be useful to them to know about the network, just let them know, tell them about it, and ask them to get in touch. You can see there's a bit of purple branding still going on. So in terms of enabling, with our 3 mission statements, inform, enable, influence, special interest group support is still ongoing. We've been very fortunate to be able to start to link into Health Education Northwest one-off funding, and the Schwartz rounds that were talked about in the morning session. That work has come out of a joint project with Health Education Northwest, supported by the network and members of the network, to roll out Schwartz rounds across the Northwest. And that's been a piece of work that Libby and Geeta and Clare Maguire have been particularly involved in. So that's evidence of, we've identified a topic, wellbeing in the workforce, there's been a fund available, and by us coming together, we've been able to put in a bid against that money. We've been successful, so we expect that to continue. Another example of that funding we've managed to achieve is the Leadership for Transformational Change training that Richard and Duncan are going to talk about later. And leadership is something that we recognise as being a really important area for us to help develop. So again, that training is an example of a kind of a bottom-up identification of an issue that we wanted to take forward, and Health Education Northwest have responded. And going forward, we have a number of projects that we're going to continue to develop that I'll outline just following this. I had a bit of a brainstorm then. So we've got a mental health and the arts project that's sort of developing out of the work that Pete Carruthers did. Again, I don't want to talk too much about that because Geeta explained what was happening. But we have a number of pieces of engagement across medicine, looking at mental health and drama, thinking about how we might develop that. So, you know, opportunity to do some things that are quite creative, which I think are quite sustaining in the austere times that we find ourselves. And then coming up, this is just a couple of headlines, but we anticipate we're going to be looking at a public health project around disseminating public mental health skills. So we're just at the moment working with public health partners to think about how that bid might look, and that will mean rolling out public mental health skills across the wider workforce, but also bringing public health skills to the mental health and psychological professions workforce. So look out for that one. And also mindfulness. I mean, Lisa has a display at the back, and there's just recently been a report called Mindful Nation that's been published. Very, very interesting. It's from the Department of Health, and it is identifying that there will be a target for training of IAPT, of mindfulness trainers attached to IAPT teams. So it's going to kind of come under the IAPT umbrella, but there is a projected target to meet a certain level of people trained in mindfulness to deliver it to so many members of the population by 2020. So as a network, we want to get involved in that. So you'll be seeing more about mindfulness over the coming year. And finally, I guess the influence is what I've talked a little bit about through all of those slides. Developing this expert narrative and having a place very firmly at the workforce planning table has been a really big piece of work that we're continuing to refine, and we want you to engage with that through the workforce board members. We're linked into the education commissioners, so we're starting to talk about continuing professional development, thinking about how we can inform that. So there are pieces of work going on, particularly around how we can develop that for the coming few years. And also we're being asked to talk about workforce transformation. So it's being recognised that our professions might have ideas about things that could be done differently, that might be solutions to problems that can't be solved by throwing new money at it, because, you know, we all know there ain't no more new money. But certainly the kind of the interest within the NHS and within Health Education Northwest is to try to harness ideas about things that might be unique solutions to problems. And often it's people that are at the ground that know where the problems are and can think about easy fixes or have ideas about things that we could try differently. So again, the network is a conduit through which they're starting to come to say, how do we harness those kind of ideas? And one of those really exciting things that, again, look out for this over the coming year, is our partner network that is for the healthcare scientists have come to us to say, is there anything that healthcare science can do to help with delivering psychological interventions or with psychological approaches? Which isn't something that we're used to thinking. But this kind of joint working provides us with an opportunity to have those sorts of blue sky thinking events that might just throw up something that healthcare scientists know about and we don't. So one of the things that we'll be doing in the coming year is having some sort of event that brings together, that's around, how can we bring science and the interventions and the tools that science bring, very tangible tools, to our professions. Are there any ideas about that? So kind of look out for that too, because we're being encouraged to think in that kind of way. So as you can probably see, there's lots of different facets to this. There's a lot of churn. There's lots and lots of different lots. And there are events like this that bring you together, and you really are the fuel that keeps the network going. And one of the things that we are very keen to use to promote the network and the work that you do is the parity of esteem agenda, as I mentioned earlier. And parity of esteem is being seen very much in terms of thinking about how does physical health and mental health have equal value? How is it thought of equally at every point of healthcare? And it's a bit of a challenge to get that message across to every bit of the NHS, because that is where it needs to be. So we're starting with physical health and psychological approaches. And at this point, I want to hand you over to Lucie, because the network has been working over this past several months on how might we communicate very simply the principles of how psychological approaches can be useful within physical healthcare. So it can be something that can be used as a tool for communication and dissemination. And Lucie's going to come and talk to you about the piece of work that she's led and show you the outcome of it.
Hello. I don't know about you, but whenever anybody asks me what I do avoid saying anything to do with psychology. Because if it's in the pub, the first thing that somebody says is, "Can you read my mind?" And then after they've got over that, they say, "Oh, I know, you're like cracker," but only if they're a certain age. And then after that, they say, "Oh, right, okay, so what you do is you do therapy." And I say, "No." And they go, "Well, what do you do then?" And I kind of sit there and I scratch my head for a while and I say, "Well, I'm a health psychologist." And they say, "Well, what's that?" And I say, "I don't really know." I wish I did. And I think even as a health psychologist, I struggle to explain what it is to be psychologically minded in your approach towards people with physical health issues, or towards all of us actually, towards physical health. And then if I think about somebody who actually is a clinical psychologist working in a health-related field, that must add an extra layer of complexity as well. And I wonder how many of you here would say that your principal role was within a physical health service. Would you raise your hands if it is? Yeah. So there are some of us. And how many of you who don't have that principal role, would you raise your hands if your role is actually about both physical and mental health in people who you see? Would you raise your hands if it is? I can see lots of nods. Raise your hands, raise your hands. Great. Okay, so actually we're working on both sides. I say we, I mean you. I'm not doing that. But you're working, if you're working with people, you're working on both sides of that. You're working with physical health and their psychological health and well-being. And that's really difficult to explain. And I think we all have people who we'd like to be able to explain that to, not just the people in the pub, but the other people that we work with, or friends, colleagues, families. So that's kind of where the idea came for this second animation. And the principal drivers for the drivers for it were to be able to explain a little bit more about how psychological approaches contribute not just to psychological health and well-being, but just health and well-being. And with those two key messages in mind, there's no health without mental health, and that there needs to be parity of esteem in order for psychological approaches to capitalise on the massive opportunity they have to make an impact on physical health as well as psychological health and well-being. So the animation shows it better than I could, so I am going to...
There isn't a single physical health problem in the world that doesn't have a psychological aspect. And by applying psychology to healthcare, psychological professionals can help to improve patients' and carers' experiences and the work that carers and policymakers do in all sorts of different ways. For instance, psychological professionals can help prevent and modify behaviours that lead to specific health problems, like obesity. They can help people cope with physical health problems across the span of an illness. They can help people adjust to the consequences of a physical health problem. And they can help carers of all kinds provide better service by understanding patients' feelings and behaviours. They can also help us understand the interaction that psychological and physical health have with each other. All of which means the opportunity for psychological professionals to make a difference to everyday care is massive. But there needs to be parity of esteem, so mental health is valued, funded and rewarded equally. And policymakers, providers and commissioners of services need to begin working effectively together. That's where we come in. The Psychological Professions Network is a hub that champions the joint importance of physical and mental health, where psychological professionals can share ideas and knowledge, and influencers can find insights. So if you're a policymaker, get in touch and find out about the psychological professions in your area. If you're a clinician, get in touch and talk to us about how we can link you into the expertise of psychological professionals. If you're an educator, get in touch to find out about how we can inform clinical skills, education and training. If you're a researcher, get in touch to discuss how we can help design and evaluate new approaches to healthcare. If you're a third sector provider, get in touch and we'll help you understand the role of psychological professionals in the workforce. If you're part of a psychological profession, join us and help make us stronger, louder and more influential. And if you're a member of the public and just want to know more, get in touch too. Whoever you are, get in touch through our website and help us improve healthcare for everyone.
Okay, so I'm going to set you a challenge now. I want you to, this is only the first bit of the challenge, I want you to turn to the person next to you and I want you to tell that person in 30 seconds who, either a role or a specific person, who you want to get that message across to. You've got 30 seconds. Do it. So we think this message should go pretty far and wide. Everyone, great. So just a thought about how you communicate with people, really, and at the risk of, teaching my grandmother to suck eggs, as it were. If you want to communicate with somebody, you have to meet them where they are, really. So you have to find out, you have to think to yourself, what is their issue that they want solved? And then how does this solve their issue? So what is the problem that they see before them, and how can I tell them that this solves it? And how can I tell them in a very short period of time? And how can I tell them using a medium of communication they already use? So we hear a lot about people saying, well, you should get yourself on Twitter or whatever, but who's on Twitter? Is the person on Twitter the person that you want to influence, or do they actually still have a Nokia non-smartphone? So who are those people? How do they normally communicate, and how can you get in touch with them? So this is the actual challenge bit. So what I want you to do is get out a piece of paper, a diary, a to-do list, a smartphone, an iPad, and I want you to make a note to yourself. It's an implementation intention. I want you to make an implementation intention about who you're going to tell about this, and about when you're going to do it, and how you're going to do it. And I want everybody to do that now. So has everybody got some sort of plan now about who, what and how they're going to communicate that message? Because there are 160 people here. It doesn't take much to work out that we can actually influence quite a lot of people with this sort of message, but they have to hear it. They have to know where it is. You have to give them the link to the YouTube link, and then you have to ask them to pass that message on to somebody as well. Although if the message is powerful enough, they'll want to do it. So what I would say is, if you just make that commitment to just one individual to pass on that message, and then hopefully we can see things improve, and that's the way that we can work.